Hi, I'm Dr. Josh L. Brown. I am a podiatrist. I have been practicing for the last 27 years, mostly on elderly patients. And I've been wanting to make this video for a long time to explain the differences between heel protector options, because there's a lot of them. And I feel like, well, I know I've been working with home health groups and hospice groups and patients for a long time, and they need this information. So let's just put it like that. Okay, so I have these little feet I'm going to demonstrate. I was using my hands to show like that was a heel, but I'm going to use my reflexology feet, which is something else that I found interesting lately with all these different pressure points. But I'm going to use this to show you different spots that I'm talking about with these heel protectors. So next page. This goes on to explain what different pressure ulcer stages are. The first stage is stage 1, and that's a pre-ulcer. It's a wound that isn't officially a wound, but it's a stage 1 ulcer because if the pressure that is there is allowed to continue, it will break down into stage 2, which is an open wound. Stage 2 is just open to the dermis, the epidermis, which is the superficial skin, and to the dermis. Has not gotten through the dermis, so you get to see it goes here, may not get through here. Stage 3 is when it gets through the dermis to the fatty layer and maybe to the muscular tissues. Stage 4 is when it gets to the bone. If a bone is exposed in a wound, there is a really high likelihood that there's a bone infection, and that can make things very complicated. There's different concerns with that when it comes to treatments like long-term antibiotics, like for multiple weeks or months, possible amputations. You want to avoid getting bone exposed. I'll just tell you that because it's hard to heal when that happens. You also want to avoid stage 3 too if you can help it. 2 also. Anyway, there's several different factors, plenty of factors. Like one's nutrition. I'm not going to get into that much, but if you have diminished protein and nutrition, and I'm a vegetarian, I believe you can get protein from many sources. It doesn't just have to be animal, but protein and other dietary factors are necessary for wound healing. So that's a factor. Another factor that's a big one is having the blood flow to send healing factors to the foot or to wherever the wound is, and also send it away. So what I recommend for anyone who has a wound that is, especially like any patient, as if they're over 55 and 60 or so, 65, it just depends on what issues you have, but most patients qualify for an annual ABI test, which is an ankle brachial index, and vascular surgeon offices and cardiologists often offer those tests once a year, typically covered by insurance. And that's a simple test that's not invasive, that you can have a blood pressure cuff on the arms and the ankles, and that just checks the variance of blood flow to see if there's any simple blockages. And sometimes there's simple fixes to help open that up. So those are recommended ABI vascular screenings. The second concern, second test is if you have something that's not healing for weeks to months, an X-ray is recommended often to rule out bone infection, to see if there's a lesion under there or a bony tumor, but that's pretty rare. But bone infection or bony problem that is preventing the wound from healing. So that's another thing that it's important to check. The one that often can cause other problems also is neuropathy. And neuropathy is basically pathology of the nerves. It's the nerves not working 100%. When they are working 100%, we shift when we get too much pressure, even when we're sleeping. But if we have nerves that aren't functioning ideally and sending those messages to our central nervous system and telling our body to do little shiftings when we're sleeping, you could have perfectly healthy, well vascularized skin that's getting pressure pressure, 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 pressure. And even if it's perfectly healthy skin, eventually it'll break down because too much pressure is an injury. So neuropathy is a big factor. So if you have tingling, numbness, burning to the feet, that is something to be extra careful and do daily skin checks to make sure you're not having any skin breakdowns, skin breakdowns. Next. All right, so this page is the stereotypical description of a heel protector. This is what most people think of when you say a heel protector. This fits on the foot just right here, only to there. And that one little strap, sometimes for this one and then the next one, sometimes them also can dig into the skin. And so if that ever happens, I recommend using using a gauze piece there or wearing socks, but also just padding there so that's not irritating the skin. But I'm going to try and say this in a way that won't get me in trouble, and hopefully I'll do it right, is that these do work for some people, mostly for people that don't move much, which is not as common as ideally would work for these. I have a lot of patients that do move, even with neuropathy, there is some moving around, and these things get kicked off or put up here to the ankle, and they don't stay in the right spots often. Sometimes they do stay in the right spot for people that stay still when they sleep or when they're in bed, but a lot of times they move, and any pressure is a problem, especially if it's for more than an hour. So keep that in mind. Oops, go back to here. I'm going to go forward to this other little one, which is also stays right here, and it helps just this spot. Doesn't help if there's pressure here or here or here. It helps for these areas, but it's not very thick. And they help some with mild issues, but if you're having mega wounds that are big blisters and wounds that are concerning more than just minor skin changes, I'd recommend something thicker. The other thing is that sometimes this material can chafe the skin, especially if they ever get wet. I have seen plenty of people where there's drainage from a wound, like whether it has a dressing or not, that it can still like seep out and get on that material, and then that irritates the heck out of the skin. So always wear these with socks. Anytime there's a wound, dress it, protect it. There's studies, plenty of studies over the years that show that wounds that are moist heal better than ones that are just scabbed over or exposed to air. You don't want it super moist though, so there's a fine line there. But protecting and covering a dressing, I think is important to prevent infections, dirt from getting in there, and then also flies. It's been rare, but I've seen it. Flies will make babies in wounds, and you don't want that. So protect them with dressings, and just keep in mind that if these get wet, can irritate the skin. Okay, here's a soft, warm, woolly option that's very similar, not very thick, may also move out of position. They work for mild things. Some people might find them nice and comfy, but I like bigger ones, like what I'm going to show here in a minute. Forgive the sizes of my pictures. I have not figured out how to make them all the same size yet. This is a set of ankle Velcro wraps that are foam pads to elevate the heel. Why I've recommended these is so that people will be able to stand up. Also, some people don't want big pads and heel booties on their feet, keeping them warm. Like some people get hot feet. But mainly I've recommended these for people that want to get up to go to the bathroom. You got to be really careful about that, because a lot of the patients that have pressure breakdown also have difficulty walking around, and you use a walker or what have you, and you could trip over these or have them in between the ankles causing tripping. So be very careful about that. One of the other things I've noticed with these is that they are often sold as size small as the first option, and that usually is not big enough, and a lot of people have had to return these or just not use them because they bought the wrong size. So you have to measure the ankle and make sure it's going to fit in whatever you get. One last note on these ones is that some people do find them very nice and comfy. Some do not because of the knees. They lift up the ankle a good amount, but then the knee is locked straight. And the goal with these is so that the pad is here and then the heel's floating over air. Basically, with anything that's a pressure issue, whether it's a callus or a wound that's pressure related, a lot of people think that you want to pad the area that has the problem, but really it's better to make that problem area not touch anything, and so have it float over air. So if you have the padding proximal to it, or if they have a callus, like say they have a callus here that keeps getting pressure, I'll put underneath their shoe inserts, I'll put a little pad that has a padding here and here and here with a hole here so that everywhere else gets pressure, but this area floats over air. And I put those underneath shoe inserts, but so that way they stay in place when you put the foot in there. If it's on top of the shoe insert, you'll just push it out of position. Anyway, that's another video, different topic. So with these, the issue can be that they have the legs too straight and the knees need support also. And so a neck roll pillow or something behind the knees also might be needed. So here is one of the ones I recommend the most, McKesson Heel Protector. Some of these have these straps, some don't. So keep in mind, I'll explain the strap so you know whether you want one or not, and just pay attention to see whether they have that. This is a dorsiflexion strap. What you're going to do is you're going to have the leg go here and then the foot go here. So the thicker, longer part goes here, and then the rest of the heel protector goes here. And then you got the straps in the front of the leg. What that strap will do is make it so that foot is more dorsiflexed. What happens, pretend this is a foot, is that when a lot of people are bedbound or limited mobility, is they spend a lot of time with their foot relaxed like this. Pretend this is a foot. So their ankle, instead of being like this, is like that, and then this all at the back of the Achilles and the back of the calf gets tight. What these straps do is they'll pull this part of the foot more up to keep this stretched out. So that way you're not getting that contraction, which can lead to knee contraction and leg contraction and general total loss of mobility. So it's helpful to have those straps. These are sold singly, so you have to get one for each foot. It's left and right is the same thing on these. You just need two. Or one, depending on if only one heel or side of the foot has a problem. So these are really good for if somebody has a heel issue, a problem here, ankle pressure. It'll cover usually up to here at least. And so that's real helpful. The next ones I show are, this one is just another general heel protector. There are so many different types of these, and a lot of them are really well reviewed. I'd recommend you look at different websites, and I like websites that have honest reviews that are not deleted. So that way you can see what people are liking and not. But I wanted to show this so that you see that the heel protectors can keep the heel floated over air. And that's what typically happens inside here as well, even though there's not always a hole like that showing it. This is Prevalon 1, 2, 3, but I'm going to show you the differences. Prevalon is a more expensive brand. You don't have to get that one, but I do like one thing about here, it's nice and soft, and that will not irritate the sides of the feet as much for some people. Stage 1 does not have the dorsiflexion strap to keep the foot up like this. Some people have a lot of ankle range of motion and they don't need it, but for people that are bedbound and they're losing some of that range of motion, you're going to want a level 2. This strap can be pulled up and velcroed to keep the foot up some. Level 3 has a wedge. There are a lot of different types that have wedges. This is just one example, but I'm going to explain why a wedge is useful and for whom. The wedges are good for people who sleep on their back and have an issue on the side of their ankle or their foot. So If you have a lesion right here, you're not going to need the wedge. If you're having a lesion here or here on the sides of your heel or on the sides of your foot or on here and here, you want the wedge because that wedge will block your foot from rolling over to the side. So it's a nice thing that this thing has Velcro on one side, and it will attach to the Velcro on the sides of the heel protector in whatever spot you need it to keep that foot from rolling over. This works well for people that sleep on their back. If they're sleeping on their side, it's not going to help because the wedge isn't going to keep them from doing that. It's going to just be uncomfortable. All right, next. This is an option that I recommend for a lot of people. Often they have to be a back sleeper, someone who's comfortable sleeping on their back. And I will often recommend this for somebody that needs a heel protector but won't wear it. And one of the most common issues is getting up to go to the bathroom. A lot of patients don't they don't want to bend down to their foot to take a heel protector on and off multiple times at night to go to the bathroom. They're just not going to do it. Compliance will just be low. And so this is a good option in that it supports the knees, it supports the legs, the heels float over the air, and they can just put their legs down, and then when they get back in bed, just put their legs up, and it's already in the spot that they need it. So that's a good option for anyone who would actually be comfortable using something like that. I have some patients that sit at the side of the bed for a urinal. Heel protector is going to twist out of position and not be useful. This is a good option for that, or anyone who has to get up and walk around to go to the bathroom that's a back sleeper. This is a good option. And the heels off elevator pads come in small, medium, and large sizes. You measure the ankle to behind the knee to get a good length because you want to make sure you have enough, not too long, so that this will float over air. You want it to not press into anything. Anywhere you're having a pressure issue, you want to float over air. That's the whole purpose of this. Well, also, if you have swelling, it'll help with that. This is another version of that I found online. I have not personal experience with these, but it looks pretty good. Just check reviews. This is just showing air mattresses, just a generic image I found online of air mattresses. Air mattresses can be wonderful. A lot of times they are not covered by insurances. To get them covered by insurances, a lot of times patients need to have wounds that are progressed enough to qualify them for it. So a stage 3 wound below the dermis of the skin on a heel or a foot can qualify them. A lot of times I have patients that have air mattresses because of pressure wounds on their behinds, on their buttocks or hips. And that air mattresses will protect your whole body from pressure issues and make it so you don't have to be rotated as much. And they do pumping of the air in and out to give the body variability so it's not getting pressure in a specific spot for too long. So that's a great option if it's available. These I don't love. I find them, some people do love them for shoes, and they help give you a little extra cushion. A lot of people, when they get older, they lose fat pad in their heels and want extra cushion, and for that it's great. A couple of times I have recommended things like this for patients where nothing else is something that they're willing to use, and at least it gives them some cushion for preventing pressure at least a little bit. One thing I don't love about gel materials or Band-Aids sticking directly against the skin is that sometimes it can macerate the skin. As long as there's not too much moisture or sweating there or chafing, irritating gel sticking to the skin, then it should be fine. Some people have no problems with it, some do. Just something to be aware of. Here's another sock that has gel built into it. Some of these socks have it built into the heel, and same thing. Sometimes the material, the gel material, is directly against the skin. Sometimes it's fabric covered, and I prefer that. So I like that. It can be covered in the fabric on both sides. Some people with ankle lesions, I think they also have gel in the ankle areas on some of these socklet things as well, like tubes. So that's another option. I do prefer the much bigger, poofier heel protectors though, because that will much more reduce the pressure. This is useful though, if nothing else will work, at least you get some protection. Also, some people really do find these comfortable for wearing in shoes. This is one I have not used personally much, but I like the concept of it. And just like that other one that wrapped around the ankle might over straighten the knee, you might need knee support as well with this. But it's another option for letting the foot breathe, have some air, and not get so hot and be elevated, and have a wedge to keep it from rolling over to the side. So it's another thing that exists. These are more rigid heel protectors that dorsiflex the foot and don't let it get all contracted. If a foot is already contracted, that's not going to work. You'd need the Velcro straps to incrementally over time flex it more and more. These ones are already rigidly in that position, and if someone's foot's doing that, it's not going to go there. So that's something to keep in mind. This one's interesting in that it has an attachable sole so that it could be stood up on and walked around somewhat in. And so the soft ones I was showing before don't have that option. I personally think socks should be worn with this, or at least some, so you're not sticking to the material here. I'm not sure how comfortable this is, but this is another option to look into. And this is my last slide for this. Most of these things that I've been recommending are for bed use or wheelchair use. I've had patients that, here we go, have their foot directly against the floor, just sitting there getting pressure, pressure, pressure. If they're sitting there with their heel into the ground and they're getting a wound right here from that pressure, use a heel protector. Especially if they're non-ambulatory, like patients in wheelchairs, use the soft heel protector when they're in wheelchairs. There are there are wheelchairs that have foot pedals that are just stationary foot pedals that you can just put the foot on. And there are some wheelchair adapter options for foot pedals that have a raisable area that will elevate the foot or both feet so that the swelling can be reduced somewhat. It doesn't lengthen the length of the chair, so they have to go up and down to get in and out of different rooms, but that's an option for swelling and such. But the heel protectors are best in bed, or if people are in wheelchairs or jerry chairs, which are a version of wheelchairs, heel protectors are great in them. Especially, I had a patient the other day who had a heel footrest, and he was resting his ankle there, and then this area was getting a wound. In addition to here, heel protector would protect both areas. So, and also recommending the caregivers to keep his feet on the pedal instead of pressing into it. This picture of what I have here is a shoe. Typically, these are post-surgical shoes to offload certain areas. They have ones that make it so that you're not pressing on the heel. They have other ones that have the heel filled in and then this area floating over air. There's just different options, but they're not used that much for regular heel wounds that are pressure related because of bed pressure. So anyway, just something else that exists to show you. That's the end of this presentation. I have a bunch of other videos I've been wanting to make, and I will get on them as soon as I can. Hopefully this has been helpful. Share it with any... I made this video for home health care providers and for my patients that have the patience to sit through this long a video, but also like hospice groups and such. I feel like there's not enough comprehensive explanations of what these things are, and what I end up seeing too much is just dispensing of these things which don't always work enough for everybody. And so I wanted to explain what the other options are and why they're appropriate for different scenarios. So thank you for listening. I am new to this. I would love likes and subscribes. That'll help it grow. and look forward to making the next one. All right.